Hi everyone. I just wanted to give you a general overview for your research paper. You know that when you first received the assignment here for your respiratory clinic class, that I had given you a rubric, and I also gave you target dates to hit. That is so that you wouldn't procrastinate. I do that because that's what I would have done. It's not due today. It would have been due 2.5, 3 months later, and very quickly time gets away from you, and you end up having to cram, and you don't end up doing your very best work. This is supposed to help you further your knowledge in a specific respiratory disease state or a treatment modality, and it's also trying to focus you into some of the ethical and financial thought processes that are required in our medical community today. But, you know, as you saw, one of the first things I asked you to do was to declare a topic. I already knew that when you declared the topic, it would probably be broad, and we would have to narrow down the topic. And that's why we set it up to have the library assist us during that process. You hopefully are using our new respiratory research page that's linked with the library so that you can take advantage of all the resources and the citation machine, making sure that your paper is written in APA format. And there's also on that website is also recognized scholarly journals that would be acceptable for your research paper. But after you've declared your topic and you've narrowed it down to a manageable topic in which you can get your research, you have to identify what questions you want to answer in your research paper. Those have been already outlined for you: financial, ethical, cost of treatment, the cost of not acting or the cost of acting for a specific treatment plan. But those are all outlined in the rubric, and I really encourage you to take a really close look at the rubric, because that's what I'm going to be using to grade your paper. I'll have a blank rubric with your name attached to the hard copy that you send me, and I will go through complete the requirement on that line for that portion of the rubric. You'll receive the full points. I'll be looking at this paper. I'm not an English major. I didn't get a master's degree in English. I have written now several papers in my lifetime, and the more you do it, the better you become. Everybody in our class has taken English 101, and I know you had to write a research paper, and that was one of the reasons that the English 101 class was a prerequisite for this course. Just like many of the other classes that you've taken. Public speaking, because you're going to be speaking in front of groups, people, physicians, families. Math 110, because we do a lot of math in our class. Physical science, so physics or chemistry, anatomy and physiology. What we do, and they directly relate to the care that we will give to a patient. It makes you a more well-rounded person. So many of you, like myself, would have panicked when you received this assignment to do the research paper, but we've broken it down into 4 parts. The declaration stage, the second stage, which was the sending me 5 credible resources that are valid within the last 5 years. If it's outside those 5 years, come and see me. You can have more than 5, but it's a minimum of 5. I would look to make sure that your resources, your articles, your journals, your books directly relate or answer the questions that you want to have answered in your research paper. Remember, your paper is a 5-page paper. 5 scholarly articles written within the last 5 years, answer maybe 5 or 6, 7 different questions that you want, and you shouldn't have a problem writing the paper. Now, I'm going to share some things that I have learned from writing a paper. I've tried many different ways, I've tried cutting some corners. I've been in your shoes before where time got away from me, and all of a sudden the paper's due within 72 hours, 48, 72 hours, and it just seems to be overwhelming. But, taking these, this is a learning experience with regards to helping you prepare to be the best respiratory therapist you can, to be able to understand the disease state, and their treatment will also help you with your clinical sims and your written registry when you take the MBRC exams. Now, once you have your articles and you have your questions that you want to have answered and you have a copy of your rubric, I would not sit down right at my computer and start typing away like you're going to type your paper and then do a spell check and submit it. I wouldn't do anything on the computer after I've done my research. I'd have my articles. Something I didn't mention before is when I'm searching my articles out, I'm going to look at my abstracts. I'm going to read the abstracts. If they seem to be interesting and seem to hit the key questions that I'm looking for, then I'm going to keep those articles. Our library resource for our research respiratory class helps you build your bibliography, and hopefully you're taking advantage of that. And that site also has the citation machine. It also has the APA format that's required for your research paper. And it also gives you several examples of acceptable resources for your research paper. It doesn't just have to be journal magazines like AARC or Journal of American Medicine or the MBRC magazine or European Respiratory Society or the SCSRC website. You can also use the books that you've purchased, which were quite expensive. You have your EGANS, you have your disease states book to use, you have your pulmonary function rubric book, all current editions, and they would be very acceptable with regards to your research paper. I would want you to do more than just those for your research paper, because we're trying to broaden your view of where you're going to get information once you leave our program. Now, once you have your resources and you have your questions and you have your topic, what's next is, what I've done is I don't try to write my paper on the computer. I don't try to cut any corners anymore. I did and it failed. I could never get a page. Once I've identified my questions, I write them out. One question on one sheet of college-ruled loose leaf paper, and I'll have 5 or 6 of those sheets with 5 or 6 of those questions, one on each page, and then I'll attach to each one of those pages a corresponding article. That would be the best case scenario. Once I'm ready, I'm going to sit down. I am going to just start writing after I've read the article and I've highlighted and I've identified key parts that I want to include. I am just going to write by hand on the loose leaf paper my thoughts. I'd ask you to write the paper in a third person and answer the questions that you want to have in your research paper. Remember, go back to your rubric and make sure that you're including the things that are on the rubric that need to be included in your paper. Important that you look of what your topic is. It could be a treatment or whatever, but we have a responsibility as respiratory therapists to try to help our community and our patients by providing the most cost-effective and the highest level of healthcare possible. And it's your job too to help your supervisors once you leave the program to be aware of certain things that are maybe cutting edge that might help your patients, decrease their length of stay, or a diagnostic modality that might help patients in their treatment regimen. But once you're just sitting down, you also don't have to do all of your pages at once. Again, remember, this is a 5-page research paper. 5-page research paper, 5 articles, minimum 6 questions. Write freehand on each paper. Don't worry about spelling. Don't worry about grammar. Try to write in the third person. The author says, it appears that the author concludes, it appears that the authors have determined. I would also try to make sure that you do not use words that are negative. Let's see. What else could I tell you when you're writing your paper? You've already done step 1, which was the declaration. Step 2 is the 5 credible resources. Step 3 is the rough draft. Once you've freehand written the paper, I don't really care. You can scan it to me. It doesn't have. Once you have your 5 credible resources, if you're using the library resource, you can actually create your bibliography page because it'll put it in APA format for you. And you can save it, print it, and that part of your paper is already done. That'll be your rough draft, and that's what I would ask you to send to me by the target date. Your final draft, your paper that you will submit for your grade, you have 2 requirements. One, to send it to me electronically, the final paper, but then I also require that you send it, that you bring me a hard copy by the target date. And the reason for the hard copy is not that I'm trying to give you an extra step, is that sometimes the formatting of your paper can change from one computer to the next. And when you print out your paper, you can see what the product looks like. And if your final product follows all the APA guidelines, the running head, the title page, the abstract, the actual body of the paper, the margins, page numbers, your citations in the paper, and your bibliography, that all your font is the same throughout the paper. Courier and New Times Roman is what is typically used, 12 font. And you see the final work in a perfect situation, which I would hope that you are striving for, that you will have not waited to the last minute. Once you've submitted to me the rough draft, you'll have a couple weeks. I would ask you then to start typing in on a Word document and to run spell checks, format the paper, have some people help you with that APA format if you need it. And once you have concluded and you put your title page and your abstract, your minimum 5 pages into the paper and your bibliography, you can have somebody else who maybe is pretty well versed in putting together a research paper. Not me, but maybe you have friends or relatives that can help you review your paper. Some things I will caution you about. Again, make sure you look at your rubric. Make sure that those things are included in your rubric, that you hit the target dates. And if you are using graphs and pictures in your research paper, they should not be so numerous that it takes up the majority of your research paper. If you have a paper that takes up a third to a half of a, then 1.5 pages. If you have several pictures and several graphs, then you need to be thinking about maybe 6 or 7 pages. I'm looking for your written thoughts of what you have been able to learn from your research, and then your final conclusion. What did you learn? And how would the medical community and our patients benefit from some of the knowledge that you have? If you hit all those target dates and you follow what I have just shared with you, and you have it reviewed, have your paper reviewed by some people who are maybe English majors, friends who are well versed in drafting, you have no problems whatsoever. We've been very lucky. We have Susan Tinker, who is willing to allow us to use her paper, and it is on the library website for the respiratory research page, webpage, and you can see what her paper looks like and how she put it together. Make sure you have completed a spell check. Make sure that it's formatted appropriately. And if you've done all those things, you're going to get an A on the research paper. It doesn't have to be unbelievably entertaining. It's a research paper. Did you learn something? Did you answer the questions? Were your resources credible? Were the authors of the research paper, did they command respect in the community for us to listen to what they were saying and to apply it in our care? And your conclusion will be what you about your research. That could be a paragraph to 2 paragraphs. Once I've done that, I'll probably go back and then do my abstract. The abstract is probably the thing I've done last. The abstract is not an indented paragraph or statement. Normally, I don't know, I think my abstracts normally have been about 4, in between 3 to 5 sentences, maybe 6, and I go from there. Well, hopefully that has helped you. If you have any questions, just stop by my office, give me a call, and I'm sure you'll be fine as long as you hit the target date. Good luck.